Hello to all students. In this video lecture, we are going to discuss anemia. If we look at the literal meaning of anemia, that is shortage of blood, deficiency of red blood cell and especially hemoglobin, which is a protein which carry oxygen. As you know that blood has many important functions, and this includes transport of oxygen from lungs to different tissues and cells of the body. And most important is the protein which binds oxygen, which is known as hemoglobin, which is an essential part of red blood cell. So when there is a deficiency of hemoglobin or red blood cell, there is a chances of getting anemia. So this is a worldwide problem all over the world, which is very common in patients, in persons of all ages, children, adults, men and women. The most common symptoms of anemia are yellowing of eyes. There is a whiteness in the eyeball. It starts getting yellower, which is a main symptom of anemia. Other symptoms include yellowing of skin, paleness of the skin, and becoming cold. Hands and feet and especially parts of the skin become cold. Shortness of breath, which is a important symptom of anemia. Some people think that the shortness of breath is due to some respiratory problem like asthma or allergic reaction, but sometimes actually it is due to a loss of blood, shortage of blood, deficiency of RBC or deficiency of hemoglobin, because hemoglobin, RBC provide oxygen to different parts of the body, but due to the lack of oxygen, this symptom, shortness of breath, takes place in our body, which is a sign of anemia. Muscular weakness, our muscles need oxygen to work properly. If they do not get enough oxygen from blood, from hemoglobin, then there is a weakness in the muscles and people become unable to perform tasks, daily tasks. Changes in stool color due to the lack of blood and problem in the small intestine, fatigue, dizziness and fainting. Sometimes people with severe anemia, they can fall suddenly and they can get head injury. So it is very important that you must know the symptoms of anemia, that if a person is having anemia or not, because sometimes it can lead to the death of a person. Low blood pressure, rapid and irregular heartbeat, palpitation, spleen enlargement, headache, and there are so many different other symptoms depending upon the type of anemia. Now we are going to discuss some important types of anemia. So the first type is aplastic anemia. In this kind of anemia, there is no production of blood in the body. So what happens? There is some problem in the bone marrow, in the stem cells, where the erythropoiesis takes place, where red blood cells are formed. So these processes are not taking place and new red blood cells are not coming inside the blood. In iron deficiency anemia, which is the most common cause of anemia worldwide, because iron is a main element, main mineral which is found in our diet. With poor diet which does not have iron in it, can lead to the iron deficiency anemia. Sickle cell anemia, which is a genetic disease. During this condition, the red blood cell becomes sickle shaped due to some defects in the formation of red blood cells. So this can also lead to anemia. Thalassemia is also a genetic disease. In this disease, there is a problem in the stem cells in the bone marrow where faulty red blood cells are formed, which are not able to perform their proper function, which is carry oxygen from lungs to different parts of the body. Vitamin deficiency anemia, it is due to vitamin B12 and folate, due to the improper intake of vitamin B12, or there is a problem in the digestive tract that vitamin B12 is not being absorbed in the body. So that is why anemia can also take place. Blood loss anemia, due to some blood loss by injury, by surgery or by some other means. If the blood has been lost from the body, that can also leads towards anemia. So now we are going to look at the different causes of anemia. So anemia can be caused by deficiency of iron, as we already mentioned, deficiency of vitamin B12 and folate. Certain severe conditions like cancer, HIV and kidney diseases can also lead towards anemia. Infection in the body like typhoid or any other severe infection, inflammation in the body or liver may also lead towards anemia. Hemolytic disease is a disease in which red blood cells are destroyed due to some genetic problem, or wrong blood transfusion may also lead towards anemia, which usually takes place in infants. Bleeding due to certain causes may be injury during an accident, surgery, menstruation in female, or during giving a birth, and during pregnancy may also leads towards anemia. Impaired production, there is less production of blood in the body due to the bone marrow problem, stem cell problem, or some other issues. Increased destruction of red blood cells, as you know that our red blood cells has 120 days of lifespan. After that they become destroyed. So if the destruction has been rapidly increasing due to some disease or some other factors, then this can also lead towards anemia. And in children especially and some adults, parasites are also a significant factor of anemia, because the parasites live in the gut and sucks blood of the person, and too many parasites in the digestive tract can also lead toward the shortage of blood in the body, which causes anemia. A normal person have too many red blood cells in the blood drop, but an anemic person has only fewer red blood cell in a drop of a blood. So how do we diagnose that it is anemia? So there are certain tests which enable us to diagnose that it is anemia. So first of all, the most important test is complete blood count test. During this test, blood is taken from a vein and it is tested for hemoglobin, red blood cell, white blood cells, platelets and some other proteins present in the blood to determine whether their quantity in the blood is appropriate or not. If the value of the hemoglobin or red blood cell is less than normal value, depending upon your age, children, female and male, they have different values of hemoglobin and iron and RBC in the blood. So if the value is less than normal value, then it is a sign of anemia. Serum ferritin, which is a protein found in the blood and which helps to bind oxygen, and if the serum ferritin level is low in the blood, it means that it is a sign of anemia. And also at this level we can also check for serum iron level too. Serum vitamin B12 is usually performed to check the deficiency of vitamin B12. Blood test for rare causes like HIV, cancer, thalassemia, sickle cell anemia, leukemia. Then we go further ahead and search for the causes of anemia with more highly tests. Sometimes we have to take bone marrow sample to test the problem in the stem cell where erythropoiesis takes place, and we know the major cause, root cause of the anemia. So if we have diagnosed that the person is having anemia, if the anemia is from mild to moderate, doctor usually try to treat this type of anemia with some foods which have more iron in it. Usually people tend to take more carbohydrates which has less amount of iron, but by taking balanced diet which is rich in iron and folate can help to overcome the deficiency of anemia. These foods includes red meat, eggs, beans, spinach and green leafy vegetables, peas, seafood, nuts, dry fruits, lentils. These are all foods which have a certain amount of, considerable amount of iron in it. By taking them regularly can lower the deficiency of iron in your blood. But if the symptom or if the anemia is in severe condition, then these foods are not going to help you. Then you have to go for other treatment options. Other treatment options include oral iron, which are known as oral supplements, iron supplements, which are usually taken as iron sulfates, which comes in the form of tablets, capsules, powder in the sachet form, which can be taken on the daily basis depending upon the severity of the anemia. But most of the time these oral supplements can cause severe allergic reaction and gut problems. So people may have diarrhea or any other kind of symptoms by taking oral supplements. If a person is having allergic reaction due to these oral supplements, then we will provide them with other supplements in the form of injection through IV fluid. So injectable iron, which comes in so many different forms and different ampules, can be injected through IV solution into the body. But if it's not causing any problem or any allergies, then this is a best method to overcome the deficiency of iron in the body. But some people may also have allergic reaction to these iron supplements. Then we have to do blood transfusion in severe cases, and when there is no medication is working, then blood transfusion after cross matching is performed. If the deficiency of iron is due to, or the anemia is due to vitamin B12 deficiency, then we inject vitamin B12 via muscles, intramuscular injection, to overcome this problem. Erythropoietin shot can also be given if there is a shortage of erythropoietin protein, which is responsible for erythropoiesis, which is the formation of red blood cell, to overcome the shortage of this protein so that formation of red blood cell can be enhanced. In some severe cases like genetic diseases like leukemia, thalassemia, sickle cell anemia, and then we have to perform bone marrow, because when we transplant bone marrow from a healthy donor to a person, then their bone marrow, because blood cells usually are formed in bone marrow, red bone marrow. So by transplanting bone marrow, healthy bone marrow to a patient can also helps to overcome this problem. So in this way, we have discussed that there are so many types, so many causes, so many symptoms of anemia, but we have to take tests on the regular basis after every 6 months, so that we can know that we are suffering from anemia or not. If there is a mild anemia, we can take healthy diet which contain iron to overcome it. If the anemia is severe, then we will go towards medication, injections to overcome this problem, because this problem is very problematic and can cause many other diseases and symptoms in the body, and sometimes it can also lead towards death. So take care of yourself, take care of your anemia, and see you in the next lecture. Bye bye.